Abortion is a complex and controversial topic that involves medical, ethical, and legal considerations. When discussing abortion risks and ethical assessments, it's important to approach the subject with sensitivity and respect for different viewpoints. I can provide you with a general overview of the topic, but it's essential to consult medical professionals and ethical experts for comprehensive and up-to-date information. Abortion risks. Abortion, like any medical procedure, carries potential risks and complications. These risks can vary depending on factors such as the gestational age of the fetus and the method used. Common risks associated with abortion include physical risks, infection. Any surgical procedure can introduce the risk of infection. Uterine perforation. In rare cases, the uterus may be punctured during the procedure. Excessive bleeding. Heavy bleeding can occur during or after the abortion. Damage to the cervix. The cervix may be damaged during certain abortion procedures. Future pregnancy complications. Multiple abortions may increase the risk of complications in future pregnancies, such as preterm birth or low birth weight. Emotional and psychological risks. Post-abortion emotional response. Some individuals may experience emotional distress, including feelings of guilt, grief, or regret. Mental health issues. While the evidence is mixed, some studies suggest a potential link between abortion and subsequent mental health problems. However, the causal relationship is complex, and individual circumstances play a significant role. It's important to note that the risks associated with abortion are generally low, especially when performed by trained medical professionals in a safe and legal environment. Additionally, the risks of continuing an unwanted pregnancy should also be considered when assessing the overall health and well-being of the pregnant individual. Ethical assessment. The ethical assessment of abortion is subjective and varies among individuals, cultures, and belief systems. Different ethical frameworks offer different perspectives on the moral status of the fetus, the rights of the pregnant individual, and the societal interests at stake. Some common ethical considerations in the abortion debate include: A. Personhood and right to life. The central question revolves around when personhood begins and whether the fetus has a right to life that outweighs other considerations. Autonomy and bodily autonomy. The right to bodily autonomy is often considered a fundamental ethical principle. Supporters of abortion argue that a pregnant individual should have the right to decide what happens to their body. Health and well-being. Ethical assessments also consider the physical and mental health implications of both continuing or terminating a pregnancy, taking into account the interests of the pregnant individual, potential future children, and society. Socioeconomic factors. The ethical assessment may take into account the socioeconomic circumstances and the potential impact of an unplanned or unwanted pregnancy on the pregnant individual, their existing family, and society. It's important to engage in respectful and open dialogue when discussing the ethical aspects of abortion, recognizing that people hold diverse beliefs and values on this topic. Please keep in mind that this response provides a general overview and does not cover all the nuances and complexities associated with abortion risks and ethical assessments. For specific medical information or a deeper ethical analysis, it's advisable to consult healthcare professionals and experts in medical ethics.